Hello, hi, this is nurse practitioner Christina Foreman, and today I like to talk to you guys about HPV. Let's talk about it. So, what is HPV? It's a genital virus that affects the genital area, like it can affect your throat, it can affect your penis, it can also affect your vaginal area. However, a lot of males always think that it's a sexually transmitted disease only for seen in females, but it's also actually seen in males. And like I said before, the way you contract it is through skin to skin contact or intercourse, oral sex, or even anal sex. However, when you do contract it, what is considered is it's actually genital warts, and there's different types of genital warts that actually puts women at risk for what's called cervical cancer, and that's what we screen for when we do our Pap smear. And some of those high risk ones that we are looking at when we're doing the Pap smear are number 16, 18, 31, 33, and 42. So if anyone has those ones, we usually send you to GYN so you can have what's called a colposcopy, and then that way they can further check. However, with women 30 years and under, you may actually be able to clear the infection as long as it's not 16, 18, 31, 33, and 42. But sometimes we still like to do a repeat Pap smear on those type of individuals, and which means we should do that between like 6 to 12 months. However, you can also do 12 months is ideally what I like to do because, like I said before, women 30 and under, you can clear it within like basically 12 to 24 months. So it kind of makes sense to do it within that year time frame instead of doing it in 6 months. Um, Also, with this type of sexually transmitted disease, it can also cause other things like cancer, like I was mentioning before. With that said, it can actually cause penile cancer. It can also cause anal cancer. It also can cause vaginal cancer, cervical cancer, and also throat cancer. However, the most popular one that most people see is cervical cancer with HPV, because basically what HPV is a genital wart. And so it looks like cauliflower inside the vaginal area, and it's kind of like these type of warts that look mimic cauliflower pretty much. And so women should also get checked, like I mentioned before. That's where we do our Pap smear, and women get checked every 3 to 5 years as ideally. However, we can also try to help with the treatments of it. Like, for example, if the person is popping up positive for HPV, multiple times, there's also medications that we can give and also treatments. Like, for example, you can do cryo, you can go do something called LEAP, which is also very helpful because that's considered LEAP is LEAP stands for loop electric surgical incision procedure, which is basically done in the OR. And they also can do what's called cryo, which they freeze the warts. And then they can do cauterization, which is burning the warts as well. And there's also creams that you can use as well. But talk to your local GYN or your primary care as far as to get more tips on how to, understand HPV and how it's transmitted. However, if you're, interested in learning more, you can also hit us off at Sophisticated Black MP, or you can follow us on Instagram at Foreman's Imperial Health. Um, Stay tuned for more information and subscribe and like. Bye.